So one of the things that we're known for here at Altis is performance therapy, which is essentially the integration and the iteration of working both performance and therapy together. So you'll see that we often have tables out by the track, and with our therapists and sometimes our coaches will be working on athletes prior to or between runs. And so this on track this week, I wanted to talk briefly about that. And effectively what we're trying to do there is improve the quality of the movement. And there's a few ways we can do that. One is we can improve the technique of the athletes by telling them to do something with their body that is more effective, for example. The other way we can do it is through some sort of therapeutic input, and it could be exercise, or it could be something on a table, or it could be something else, where we're trying to actually change the way an athlete moves through doing some sort of input. Okay, so what does this look like in practice? It starts with the communication between the athlete, the coach, and the therapist, with the goal of trying to determine what the most appropriate loading is for that day. And we base that decision on how the athlete feels, what the coaches see as the athlete's warming up, and then what the therapist sees as the athlete's warming up, and also what he feels and sees when the athlete is on the table. And then we all come together as a team, as what we call the performance trinity, to determine what the most appropriate loading is for that day, and whether that's a little bit different or the same as what was scripted. So join us next time when we look at what this actually looks like in practice and how you can implement it into your own training.